Besides COVID-19, we have a huge epidemic in the developed world as well, and this is obesity. And it has started years ago and didn't finish. I think we haven't reached the top of obesity. And obesity is associated with gynae cancers in two ways. First, it's a risk factor for developing gynecological cancer, especially endometrial cancer. And on the other side, it is associated as a risk factors for complications of treatment, and it is sort of a risk factor that clinicians working with obese patient have a lower level when they decide to not proceed with optimal treatment modality, just because the patient is obese. On the other hand, obese patients have other medical conditions that are associated with obesity, like hypertension, diabetes, and they all are associated again with complications of treatment. And this was the background for the session. And we highlighted what could be the possible solutions when we approach to the patient with gynae cancer and being obese at the same time. And the solutions were presented for surgical treatment. Nadim Abu Rustum showed a different surgical approach that improved visibility in the abdomen during the surgical procedures. And then we saw solutions associated with radiation therapy, because radiation oncologists actually do not have so many problems with obesity as surgeons, and actually they can proceed with optimal treatment that is not so the obesity is not a risk factor for complications in radiation therapy. So radiation therapy is one of the solutions when we have patients with a high risk factor, with a high risk for complications after surgery. We can avoid surgery and start treatment with radiation alone. And then also with systemic treatment, the hormone therapy, especially local hormone therapy for endometrial cancer with IOD, with gestogens, is also one possibility for early stage endometrial cancer to avoid surgery or to postpone surgery after the treatment of obesity, so that we can motivate patients to lose weight before being operated.